How's it going, everyone? I'm Dr. Vear at Binger Chiropractic here in Huntley, Illinois. And today we're going to talk about carpal tunnel syndrome, specifically when what's called the median nerve gets trapped within the carpal tunnel. Now, carpal tunnel syndrome is predominantly what's called an ischemic injury, where there's compression on the nerve as it enters the wrist. Now, a couple factors that can help identify carpal tunnel syndrome is that you have these three fingers and the inside of this finger go numb primarily at night. It happens about 3-to-1 or 2-to-1 more common in women, as well as in the age ranges of 40 to 65. And typically what you'll see with carpal tunnel syndrome is compression on the wrist from everyday jobs that require repetitive stress injuries, such as assembly line workers, store clerks, or data entry workers. And what that causes is it causes compression within the wrist, which swell and compress the nerve, which can affect those symptoms that you're feeling. Now, a lot of times a hallmark of carpal tunnel syndrome, as opposed to what's called pronary artery syndrome, is what's called thenar wasting. And what that means is the muscle on the inside of the thumb gets loose, and it feels like you're losing muscle. You have difficulty grabbing or pinching or picking up things for very long periods of time. So what we do here at Binger Chiropractic to help cure that, or at least help alleviate it, is what's called myofascial release. So if we have compression on the wrist, we need to break up that compression and allow the nerve to free up. So a couple ways we do that here is we can use an instrument called the speeder board. And what this does is we put your wrist on the adjustment and we adjust out the wrist. And what that does is it helps free up the joints and allows more room for that nerve to move around so it doesn't get as compressed. The next thing we do is what's called Graston technique, or instrument assisted soft tissue massage. Basically, we take this metal beveled edge and we can break down the tissue around the wrist, which helps loosen up the tissue, breaks apart scar tissue, and that frees up the median nerve as well. And that's going to help loosen up and give that nerve more room to breathe. Last thing we can do here is what's called median nerve flossing. A lot of times the median nerve gets trapped at the carpal tunnel, but it can be trapped all the way as it comes out of your neck. So one way to fix that is we have to kind of thread the needle like as if it was a piece of dental floss. And what we do that is we start here and we just move the nerve throughout the head like that. And that can help kind of floss out the nerve and help break it free from any type of adhesion that is causing the carpal tunnel syndrome. So if you like that video and you have any more questions, be sure to follow us, give us a like to the page, and we'll catch you on the next video.